You wake up in the morning, can barely stand straight, and think you probably just slept the wrong way. But what if the pain keeps coming back? Pain that shoots down your leg or gets worse every time you sit. That's not just a back pain. That could be a herniated disc, and ignoring it could cost you a lot. Hi, I'm Dr. Jayesh, a spine surgeon, and every single day I see patients who brushed off these exact warning signs for months and came to me only when things got serious. By the end of this video, you'll know the 5 clear warning signs that separate a herniated disc from regular back pain. Plus, one red flag at the end of that means you need to go to an ER immediately. Before we dive in, if you've never heard the term slip disc, that's exactly what a herniated disc is. Same condition, different name. In fact, most patients walk into my clinic saying, "Doctor, I think I have a slip disc," and they are absolutely right. So whether you call it a slip disc or a herniated disc, everything in this video applies to you. Here are the 5 warning signs that you need to look out for to identify if your back pain is actually a herniated disc. Sign number 1, the pain travels. The pain travels in your leg, knee or foot, and this is a clear sign of nerve compression and you should never ignore it. A standard back pain will never cause your foot to go numb. The pain of herniated disc starts from the lower back, traveling down the leg and sometimes all the way to the foot like an electric shock. This is your sciatic nerve being compressed. Sign number 2, weakness in your leg or foot. If you constantly feel pins and needles in your leg or foot, if you have a patch of skin in your leg that feels completely numb when you touch it and pay close attention. This happens because herniated disc is physically compressing the nerve, cutting off the normal sensory signals that travel from your leg towards the brain. A standard muscle ache will never cause your foot to go numb. Sign number 3, muscle weakness. Nerves don't just carry feelings, they carry the electrical signals that tell your muscles to move. If a nerve is compressed by a bulging disc for too long, the muscles that it controls start to fail. You might notice yourself stumbling, like your knee is giving out, or experiencing something called as foot drop, where you physically struggle to lift the front part of your foot while walking. This requires immediate medical attention. Sign number 4, your pain spikes with specific everyday actions. I'm talking about coughing, sneezing, or even laughing hard. These sudden actions drastically increase the pressure inside your abdomen and therefore in your spinal canal. If you have a herniated disc, a simple sneeze can cause a sudden agonizing spike of pain down your leg. You will also notice pain that gets significantly worse when bending forward to tie your shoes, sitting for long periods, as these positions put maximum mechanical load on the front of your disc, pushing the herniated disc further into your nerves. And sign number 5, pain is only on one side. When it is possible for a central disc herniation to affect both sides most of the time, herniated disc pain is usually felt on either left or right side, but not equally on both sides. If your pain is consistently on one side, take note. So remember, these 5 signs tell you it's more than just a back pain: one-sided pain, shooting leg pain, numbness, pain that worsens on sitting, and leg weakness. And if you're losing control of your bladder or bowel, this is a spinal emergency called as cauda equina syndrome. Go to the ER immediately. Do not wait on it. Your one-step action for today: if any of these signs feel familiar, book an appointment with a spine specialist this week itself. Don't wait for it to get worse. If this video helped, like and share it. You might just save someone from an unnecessary surgery.